البرنسبل اوف سيرجري. اخذنا المحاضره السابقه البري اوب اسسمنت وقلنا شلون تحضر المريض قبل العمليه، والبنفيت اوف بري اوب اسسمنت هو to prepare patient and to avoid post operative complication. ممكن المريض جاي يسوي عمليه بس ما يعرف نفسه انه عنده comorbidity like diabetes, respiratory, cardiovascular. So the pre-op assessment include assessment by history, examination, and regarding the important medical problem like diabetes or smoking, pregnancy. Okay, take detailed drug history. Okay, and then investigate the patient regarding biochemical and assessment of the cardiovascular, respiratory. بالاخير ناخذ الكونسنت اوف بيشنت، وهي بالمحاضره السابقه وقلنا الكونسنت لازم تفهم المريض شنو مخاطر العمليه، شنو البروسيجر راح تسويه، شنو ممكن ايش راح يصير بالعمليه، وتاخذ موافقه المريض بالذات. واكو ظروف انه المريض ما تقدر تاخذ موافقته، مثل الاطفال، مثل mental retardation، مثل الموقوفين. اوكي، هسه ناخذ البوست اوبراتيف كوميونيكيشن or post operative care. العفو, not complication just. The aim of post-operative care is to provide the patient with as quick, painless, and safe recovery from surgery as possible. Okay, whatever the surgery. General management of the post-operative care include immediate post-operative period. In the immediate post-operative period, patient is nursed in a recovery area using one-to-one nursing and continuous monitoring. The role of recovery nurse is to ensure that the patient is protecting their airway, breathing, and perfusing adequately. So it is very important to assess the airway and breathing and circulation immediate after surgery. Recovery nurse should also monitor the patient pain as the anesthetic wear off and ensure that there are no early complications like bleeding or ischemic distal circulation or ischemic limb and or sensation. Blood pressure, pulse, oxygen saturation are therefore monitored regularly in the recovery unit. Trend seen on this chart reassure the recovery nurse that patient is recovering well and one that the complication is developing at the recovery unit. Patient recovery, when the patient are fully conscious and comfortable and their vital sign are stable, then they are transferred to the general ward. However, the patients who are at risk may be transferred to the high dependence unit or intensive care unit. While on the ward, patients should be visited at least morning and evening by medical staff to ensure that there is TD process. All staff on this round must wash their hand between every patient to avoid nosocomial infection between patient and patient. When they visit patient, we should ask them about how they are, شلونك هسه, okay? Especially ask about pain, nausea, and mobility, and anxiety, disorientation, or change in behavior, or often the first sign that complications are setting in. While the objective اللي تبحث عنه من المريض, check the patient chart regarding temperature, pulse, respiration, fluid balance, and any specific observation recorded by the nurse, such as color of graft, patient pressure area should be checked. But if the wound is to be inspected, if possible, the wound should be left undisturbed for 48 hours after surgery to prevent contamination. يعني ملخص الحكي انه الووند نوت انتربتد ولا نلاحظ الووند خلال اول 48 ساعه، لانه بهذا الاريا بهذا الوقت ما يصير ووند انفكشن. Specific contamination also need to be recorded, such as bowel sound after abdominal surgery or distal neurovascular status after orthopedic procedures. Post-operative care, the pain is very important to be controlled, and IV fluid should be given to the patient post-op. So the pain control is important, not only to avoid the disturbance that is caused by pain, but in addition, uncontrolled pain delay recovery and increase post-operative complication. For example, pain from the chest and upper abdominal incision inhibit both adequate respiratory effort and clearance of the circulation. So control of pain reduce the incidence of post-operative chest infection and atelectasis. In other aspect, pain after abdominal incision is a factor in post-operative ileus, and the reduction of this complication in laparoscopic surgery is probably in part related to the reduction in abdominal wall wound pain. Pain is also associated with the many of troublesome post-operatively, like nausea causing hypotension episode with prevent satisfactory discharge after day surgery. We control pain symbol by symbol, okay? We start by oral analgesia. It's common mainstay for pain control at the day surgery, okay? A combination of non-steroidal anti-inflammatory like Provine مثلا, with preparation of paracetamol and codeine prove satisfactory in most patients. Another mode of pain control هو local anesthetic infiltration. Local infiltration of the xylocaine into the wound provide excellent pain relief in the critical phase 6 hours after surgery, and may be more effective if it is given at the start rather than at the end of operation. يعني بنعطي local anesthesia للمنطقة اللي ممكن انه نسوي بها جرح العملية قبل البروسيجر، يكون اكثر فائدة من بعد البروسيجر local infiltration. Intramuscular opiate. These are administered as a bolus injection with required every 4 إلى 6 hours and were for many years the mainstay of post-operative inpatient pain control. يعني عادة تعطي للمرضى اللي داخلين بالمستشفى لأنه تحتوي على complication إذا نطت بالبيت، ولذلك ما ينطي البروفين والبثيدين بالبيت لأنه بي complication وخاصة respiratory depression. Patients frequently require intramuscular or intravenous pain relief in the recovery area, and this is followed by further injections as necessary. Intravenous opiate, not intramuscular, intravenous. This is the fastest method of bringing severe pain under control. 2.5 milligram dose of intravenous morphine is safe for an adult in severe pain and can be repeated at 5-minute interval if necessary, up to total of 10 milligram. Patient control analgesia. هذه method of giving analgesia is a system that delivery of intravenous opiate. The dose of this is controlled by the patient. يعني dose of the morphine and bethidine controlled by the patient according to the pain. Okay, the patient can be administered bolus usually of 1 milligram in adult by pressing control button. Epidural analgesia. This is an extremely satisfactory method of ensuring the pain-free early post-operative period after major surgery like abdominal or thoracic surgery without a sedative effect of opiate. An epidural catheter is placed in situ by the anesthetist, and analgesia is maintained by a continuous infusion of the local anesthesia agent or opiate into the catheter. Avoid overdose can be responsible for hypotension and failure of delivery from the blockage, or misplaced catheter can result in severe breakthrough pain, which is sometimes difficult to control, very difficult to control by displaced catheter or giving opiate outside the area of epidural catheter. intravenous fluid requirement. خلصنا البين كنترول. بعد العمليه المريض ممكن نعطي خاصه الانترا ابدومينال سيرجري need intravenous fluid therapy will be unable to take oral fluid for several days, so they need fluid. Maintenance of fluid and electrolyte are giving intravenously وفق شارت معين. المهم بالفلويد انه type of fluid and amount of fluid. نيجي على الاماونت اوف فلويد نحسبها according to the weight according to the kg. كل 10 100 مل بير كي جي لل10 كيلوات الاولى من الوزن، وكذلك بعدين نضيف 50 مل بير كي جي فور سكند 10 كي جي. بعدين لل10 الثالثه من الويت نضيف 25 مل بير كي جي. يعني فرضا اذا هو مثلا 30 كيلو وزنه، اول 10 100 مل بير كي جي يعني 1000، وثاني 10 50 مل بير كي جي يعني 500، وثالث 10 اوكي 25 مل بير كي جي يعني 250. التوتال يصير 1750 مل لمده 24 ساعه. اوكي اذا تشيلدرن اندر 10 كي جي نعطي شويه زايد 150 مل بير كي جي. regarding the sodium and potassium، الصوديوم 1.5 الى 2 ملي مول بير كي جي، والبوتاسيوم هو 1 ملي مول بير كي جي. اوكي regarding the type of the fluid، the preferable type of the fluid هو water, dextrose water, because avoid sodium in the first 24 hours, because the antidiuretic hormones and noradrenaline, adrenaline and corticosteroid in the first 24 hours will be increased as a response to the surgery. So it is glucose water is preferable in the first 24 hours to avoid hypernatremia of the sodium chloride solution. Post-operative complication. What is the post-operative complication? In general, complication associated with the introduction of the infusion, air embolism. This may occur when more than 15 ml of air is accidentally introduced during or after insertion of a venous catheter. The air enter the right atrium, preventing adequate right heart filling and causing drop in the blood pressure, a rise in the pulse rate and distension of the jugular venous pressure. It can be avoided by running fluid through the giving set before the connecting them to the patient. الاير امبوليزم شرط من شروطه انه 15 ml of air will be accidentally introduced. يعني إذا drop of air, it is not the effect that have much importance. Patient should also head down. Okay. Another complication هو phlebitis. A needle or catheter insert into vein will be eventually result in inflammation around the area called phlebitis, superficial phlebitis. Finger necrosis. Arterial line are usually inserted in patients who are require continuous monitoring of pulse, blood pressure, and arterial blood gases. They are usually inserted into the radial or femoral artery. In some patients, the blood supply to the hand arises predominantly or completely from the radial artery, with little contribution from the ulnar artery. There is individual variation. In these cases, cannulation of the radial artery may disrupt the blood supply to the hand, causing ischemia, necrosis to the finger. Another specific post-operative complication regarding respiratory complication, regarding cardiovascular, regarding GIT, regarding the genitourinary. Regarding the respiratory complication may be reduced by using adequate analgesia. مثل ما قلنا, post-operative complication or infection usually reduced by adequate analgesia, including epidural and using analgesia that depress respiratory carefully. Okay, administration of oxygen using face mask or nasal bronch. Arranging regular physiotherapy post-op, especially in patients with respiratory problem like asthma or chronic obstructive airway disease. Postponing surgery in any patient with have upper respiratory tract infection. Should be postponed surgery in patients with acute respiratory tract infection. Shortness of breath post-op. The commonest cause of shortness of breath, dyspnea, and rapid shallow breathing is alveolar collapse or atelectasis. The diagnosis is confirmed by clinical examination and radiography. Abdominal surgery wound may compromise respiratory function by splitting the diaphragm. Sudden onset of shortness of breath and tachypnea and increased respiratory rate may be caused by pulmonary embolism. Further cause of more gradual onset post-operative shortness of breath is acutely respiratory distress syndrome. This may be followed another causes of this ARDS by chest trauma, acute pancreatitis, sepsis, and result in poor oxygen transfer to the lung. Even when the patient is giving supplementary oxygen and is well perfused, any foreign body in the mouth, including denture, vomiting should be removed, the neck should be extended and jaw pulled forward to allow the tongue to come forward, freeing the airway. The oral airway should be maintained and protected by an airway tube. Cyanosis. In patients whose airway is cleared but who develop cyanosis, the problem may be in the lung or in the circulation, cardiac. Common problem in the lung may be acute bronchospasm as a result of asthmatic attack, or may be pneumothorax as a complication of anesthetic intubation detected by loss of air entry into the upper chest. Circulatory problem include sudden blood loss causing a decreased venous return, myocardial infarction, acute post-operative myocardial infarction, or even intra-op, or a massive pulmonary embolism, whether intra-op or post-op. Regarding the cardiovascular complication, hypotension. What is the cause of hypotension in the post-operative period? Low blood pressure, maybe patient dehydrated, ما ماخذ fluid زين, okay? Or maybe patient had epidural anesthesia. Epidural, one of causes of hypotension is epidural anesthesia. Or the patient maybe have bleeding, or patient have too much morphine, or patient maybe have a cardiac failure due to myocardial infarction. These are causes of hypotension post-op. Hypertension, على العكس من hypotension. High blood pressure may be dangerous in patients with ischemic heart disease or cerebral vascular disease, as may be precipitate infarction or stroke. Most causes of hypertension related to the inadequate pain relief or anxiety. So the pain control is very important to reduce the post-operative complication, even hypertension. Deep vein thrombosis, these are several risk factors for deep vein thrombosis, include the age more than 60 years, recent surgery, particularly pelvic or lower limb surgery, immobilization, يبقى المريض فترة 3 أيام 4 ما يتحرك ما يقوم من مكانه. هاي واحدة من الكوزز of DVT. Trauma, patient taking oral contraceptive pills, ولذلك قلنا الاورال contraceptive pills بالدراج هيستوري بالبري اوب اسسمنت لازم يقطع 4 إلى 6 أسابيع if the patient or female taking oral contraceptive pills. Obesity, heart failure, cancer, even when the defect in the vein or artery, arteriopathy. These all causes of DVT. Most hospitals have a DVT prophylactic protocol. This may include the use of stocking, calf pump, and pharmacological agents such as low molecular weight heparin. يعني مريض من نريد انه نتجنب يصير عنده DVT ممكن نعطيه نسوي له calf pumps electrical اكو calf pumps, okay, controlled calf pumps, or نعطيه heparin low molecular weight post pre-op نعطيه or at induction, okay, according to the hospital protocol. Gastrointestinal complication, post-operative nausea and vomiting is very important in after surgery. This is a common problem, may have adverse effect of outcome of surgery, including wound dehiscence and pulmonary aspiration if the patient airway is not protected well. Prolonged nausea and vomiting result in increased pain levels and prolonged hospital stay. The following are predisposing factors for nausea and vomiting in patient after surgery. Poorly controlled pain, pain causing nausea and vomiting. Use of opioid, واحدة من الكومبليكيشن of opioid اللي هو المورفين والبethidine يسوي نوزيا, ولذلك عادة نعطيهم اياهم بلاسيل. Surgery on the gastrointestinal tract, okay, especially orthopedic surgery or ear, nose, خاصة ENT surgery. Female sex بحد ذاتها هو cause of nausea and vomiting. Young adult, history of pre-operative vomiting, history of motion sickness or migraine, acute gastric dilatation, all these causes of nausea and vomiting post-op. The last complication هو urinary complication. Urine output, oliguria or anuria post-op. What is the cause of oliguria? Oliguria definition معناتها هو when the urine output less than 0.5 ml per kg per hour. Okay, the commonest cause of oliguria post-operatively is reduced renal perfusion result from pre-operative hypotension or inadequate fluid replacement. انت هو المريض ما ياخذ اورال، اوكي، وما تعطي فلويد بالحساب المضبوط حسب المعادله اللي قلت لكم اياها، فاكيد عنده راح يصير هايبوتنشن ومن ثم اوليجوريا. If untreated acute renal failure may develop. Serum level of urea and of creatinine should be measured daily until the patient is fully recovered. The fluid chart must be checked daily by the medical staff and the fluid balance calculation checked. يعني لازم تشيك مريضك بوست اوب باي فلويد ايش قد اخذ وايش قد طلع بالدرين، ايش قد عوضه، الدرين لازم اعوضه، باليورين اوتبوت لازم اعوضه، اوكي، يعني ديلي مثل حسب المعادله قلنا من تقريبا من 2 الى 3 لتر بير داي يحتاج المريض or according to the kg اللي حسبنا لكم اياها. Urinary retention. This is frequently seen in the post-operative patient, particularly men who have bed bound post-operatively. The inability to void after surgery is particularly common with the pelvic and perineal operation like hemorrhoidectomy. After a procedure performed under spinal anesthesia, is commonly have urinary retention after surgery, which is confirmed by examination and by ultrasound, may require catheterization. Catheter should be performed prophylactically when the operation is expected to last for 3 hours or longer. When large volume of the fluid are administered, we introduce urinary catheter prophylactically. يعني قبل لا يصير عنده retention نخلي له كاثيتر إذا العملية تطول أكثر من 3 ساعات or large amount of the fluid will be taken. Okay, urinary tract infection. This is one of the most common complications after surgery. Okay, are especially in immune compromised patient or a patient have pre-existing urinary tract infection or urinary retention or history of presence of catheterization. بحد ذات الكاثيتر هو واحد من ال predisposing factor of urinary infection. Diagnosis by confirmed by dipstick urinary test and sending sample for culture and sensitivity. Treatment involve adequate hydration and adequate bladder drainage together with the use of antibiotic according to the culture and sensitivity. This is the post-operative care and complication in general in any patient undergoing surgery. Okay, لذلك احنا بالجراحة أخذنا pre-operative assessment and post-operative care and complication. المحاضرة الجاية إن شاء الله surgical site infection اللي هو عادة تصير post op. اوكي، إذا عندكم أسئلة دزوها لي عن طريق رقمي الشخصي أو عن طريق الكلاس روم اللي راح نسويه، ومثل ما قلت لكم بأي لحظة أنه أنتم ممكن نسوي لكم كويزات، وحضوركم لحد الآن هم مو زين، يعني كان بالثمانينات أول محاضرة هسه جاي ينقص، وهذا يعني مو تعليم تفاعلي. أوكي، بالتوفيق إن شاء الله، شكرا جزيلا.